right, guys, so today we're going to talk about 6 questions to be asking your patients to come up with a solid plan of care for them. So whether you're working in-network or out-of-network, you've probably seen someone who's gone to their doctor for their injury. They come to you with a prescription that says something like 2 times a week for 6 weeks. As we see, this is pretty standard procedure across the board, but not always super specific to the person in front of us. So by asking these 6 things, you can really get a good idea of what your patient needs and what's going to work best for them to create a plan that's going to work best with their lifestyle. So first question we're going to talk about is timeline, meaning how quickly does someone want this problem fixed? So that might seem like a silly question. Duh, everyone wants this fixed as soon as possible, but you'd be surprised. There are those people who have had back pain or whatever for years and years, and they're well aware that this is not something that's going to be fixed overnight. But then you have those people who have more of an acute injury. They're playing a sport, they're in the season, they have a race coming up, whatever it is, and those people are going to expect results a lot faster. Obviously, things like physiology are going to come into play with this. So for those acute injuries, taking into consideration healing times, taking into consideration how long this injury's been going on, how severe it is, are all going to play a part in how quickly they're going to recover. But aside from those things, I think it's safe to say that in general, the more someone's coming in for PT, especially at the beginning, the quicker we can get them on track, the quicker they're going to start to see changes. All right, next few questions have everything to do with building out a home exercise program and how that works with how frequently they're coming in for physical therapy. So the next question you're going to want to ask is how much time someone has to do things at home. I think a lot of times that in school, we come out as new PTs, we're like, okay, we're going to give our patients all the tools they need to be self-sufficient and do things on their own, but that's not going to work for everyone. So before you give someone some extensive home exercise program, make sure that they have the time to do it and that they want to do it. So if someone tells you that they only have 10 minutes to do something, you're not going to be giving them a million exercises and expect them to work out for an hour at home. But that means they should be probably getting in more frequently for PT if they're not doing things at home. On the flip side of that, you have those people who really want to get this taken care of. They'll spend an hour a day doing whatever exercises you give them. And maybe this person can't get in 2 to 3 times a week, but that's okay. If they're doing the things at home, they're still going to see the results. Okay, so next question going along with this is figuring out how this person moves and what their coordination is like. So asking someone, how confident are they performing exercises on their own, and how confident are they that they can do them correctly? Oftentimes you will probably see this as soon as you start taking someone through movement, but these people often know who they are. They're usually going to say, like, I have terrible form, or I have a hard time following cues or whatever it is. So maybe someone's super motivated to go home and do a bunch of stuff, but take into consideration that if they're not doing it well, they might not reap all of the benefits. And usually these people that aren't as coordinated are going to be more than happy to be getting into PT more frequently, have your hands on cues, have your guidance a little bit more often. Last question that has to do with building a home exercise program in comparison to how frequently they're getting into PT is how accountable are they? Are they going to do the things that you give them at home? I think it goes without saying, pretty simple, that if they're not doing things at home, they should be getting in here more frequently. Circling back to that, helping our patients be self-sufficient. I think that for some people that works, and for some people that's their goal, is to get more on track. But if they're not, getting in a couple times for PT is going to help keep them consistent and help them get there. On the other side of that, there are those people that's not their goal. They're not going to do things on their own. They're not huge into exercise. I mean, think about all the people who pay a bunch for personal trainers for group classes because they're not going to do things by themselves. We can be that consistent coach, that consistent guidance for someone as well, and that's okay. All right, last 2 questions. We're moving away from home exercises and all that stuff for these last 2. So 5th question is knowing about your patient's schedule. So is it easy or is it difficult for them to get in for physical therapy? Some people have no limitations in their schedule. Great, let's get them in as much as we can to get them seeing the results as quick as possible. But other people have busy lives. They can't get in here all the time. But with those people, that's when we have to have those conversations about setting expectation, knowing that there is going to be some work they're going to be having to do on their own if they're expecting to see the same results, but only getting in once a week or every other week or whatever that looks like. All right, so last question, we're going to be talking about budget, especially for people who are in out-of-network settings or cash pay settings. This seems very obvious and relevant. That cost can seem to be a little bit more of a factor for people sometimes. But I think that even in network clinics, this can be a conversation. I know when I was working in network, I didn't see this very often, but I'll tell you guys how this can play more of a role. So in out-of-network, obviously, if someone's really committed to getting things taken care of, but they're on more of a budget, that doesn't mean we can't help them. But this is really where you're going to have to take into consideration how they answered all the other questions to see if those things are in alignment and see how they can still get value out of coming here. On the in-network side, if you're seeing people who are coming in and insurance is covering it up front, you might not be having this conversation at the beginning, but later on, think about all those times that people run out of insurance, they run out of sessions. Maybe they can do all their ADLs and they're moving fine with that, but they're not able to get back to sport, or they're not really able to do those higher level activities yet. If they're still getting value from physical therapy, why not have that conversation with them of what the out-of-pocket price is to continue them on their goals. All right, guys, so there you have the 6 questions to ask to come up with a solid plan of care for your patients. We use all of these on our intake form, and we take time during the evaluation to go over all of these and have a conversation about it. But regardless of how you fit it in, I think all of these are going to be valuable to know before the end of that evaluation. Depending how your patients answer, it might be really easy to come up with a plan of care. Other times it might be a little bit more challenging depending on how they answer things, and that's where you might have to have more of a conversation about expectations and recovery time, things like that. But regardless of how it turns out, I think your patients are really going to appreciate that you took the time to get to know them and what works for them and their lifestyle. Try it out.